Are we live? You guys, I'm so excited. So you guys know me. I'm Alicia. I'm here at the Laser Institute of Pinehurst. I have got my demo. Say hey, Amber.
Hello.
So you guys, I want you to hop on. Once you hop on, I want you to spread the video around so everybody can see the wonderful peel that is about to take place. So yes, once you hop on, sprinkle our video out so that the Facebook gods will see us and spread us all around. So what we're going to do today, so you guys, I'm super excited because peel season is here. If you've ever had a chemical peel, you know that there's all different types, all different kinds. Today we're going to be using our Blue Radiance Peel. So this is our Blue Radiance Peel. Let me show you here. This is our Blue Radiance Peel. This is perfect, truthfully, for all skin types. Not to mention the fact you can get yours for free. We will let you know in our description below, as well as we continue with our treatment. So I want to, first of all, we're going to go ahead and cleanse the skin of my patient. So I'm going to cleanse her skin. So we are doing a live demo of a chemical peel. So if you have any questions, please feel free to ask. I've got Chastity here. She's going to totally help me see all of your questions and ask as this service is performed. So as you can see, I'm going to take a look at Amber's skin, and of course she has a little bit of makeup on the face. I'm going to get that off first. So I'm going to go ahead first and just get the makeup off of her face. We want to make sure that there's nothing in the way of our peel being able to penetrate into her skin. So we're going to go in here and just remove makeup. Amber, how do you feel?
Wonderful.
Wonderful. She says, I feel really good. I'm getting a chemical peel finally. Everyone always comes in the office and they're like, you ladies, your skin looks so nice. Well, this is why, because we take care of it, right? Mm-hmm. So have you done this peel before, Amber?
Yes.
You have?
Mm-hmm.
And what was your experience like before?
Tingling sensation, warmth, but very tolerable.
Very tolerable. So we have so many different levels in chemical peels. So you really want to come in and have a consultation with one of our experts on what type of peel that you're looking for. Maybe you want a very intense dramatic peel, and we can totally perform that for you. Maybe you want just a little bit of light resurfacing. We can do that as well. What we're going to do today on Amber, as I mentioned to you guys, this is called the Obagi Blue Radiance Peel. This one is suitable for all skin types. So we're actually able to address even from the fairest of skin to the darkest of skin. We're able to address it safely and get a good exfoliation of the skin. I'm going to start, of course, if you're just joining us, we are doing a chemical peel. I'm going to start by making sure I've got all of the makeup off the skin. Looking pretty good, Amber.
So Alicia, you said this is suitable for all skin types. You said we have levels, gentle exfoliation to a deeper peel. So what concerns would someone have that would lead them to getting a chemical peel over other services that we do?
What I have found when I am kind of directing my patients on which services that they should have done, first of all, kind of figuring out what their skincare needs are, what they want to see take place. A lot of patients that come in for a chemical peel, they have texture issues. Maybe their skin does not feel smooth, or maybe they have some sun damage or enlarged pores. A lot of patients will come in because they have breakouts, so they might have acne and they want to get rid of the acne. With the different levels of chemical peels, we can do just that. I can, depending on, so with my Blue Radiance, because that's the one we're going to kind of focus on today, that is an Obagi product. Obagi is known for being a physician-dispensed skincare line because there are prescriptive ingredients in it. So you've got retinols, you've got hydroquinone, you've got lightening agents. So this peel couples with that Neuterm system beautifully to give you that radiant look to the skin, to help resurface, to get rid of fine lines, wrinkles, helps get rid of acne, helps get rid of scarring, enlarged pores, things of that nature. And this one's really nice, done in a series. So I've got Amber's, I'm gonna let you hold this little fan, not because I need you, not because it's gonna hurt, but some of the products smell. So I'll let you hold on to that. We're gonna let you hold on to that. So what I'm gonna do first, now that I've got her skin cleansed, I'm going to use what's called a prep solution. You see that there?
Yes.
This prep solution is going to allow me to get a nice, even distribution of my peel product itself. So I'm gonna start right at the top here. And this one, Amber, this one will not have any type of stinging or tingling or anything like this. This actually will feel quite refreshing. How's that feel?
Smells good. It smells like witch hazel.
Does it? Mm-hmm.
So you mentioned this peel, the Obagi Blue Radiance Peel, pairing beautifully with the Obagi Nuderm system. So I believe we do have a special this month. So can you tell us about that?
Yes, actually. The Blue Radiance Peel is typically a service that's $150 to have one treatment done. We do sell them in a package, so if you want to come in and get a package treatment, you absolutely can. But this month, and while supplies last, we actually have, if you purchase any Nuderm system or the C clarifying system. So if you purchase any of our skincare systems that do have the prescription components, so they're going to help with fine lines, wrinkles, pores, discoloration, pigment especially, so eliminating sun damage, you're going to get this peel right here for free, as well as, what else comes with it, Amber? Remind me.
A tote, right?
Yes,
T-shirt,
yes.
travel size cleanser, travel size toner, and then your free peel. Stacy is on. Hey Stacy, thanks for joining us. She said it's frozen. Are you able to see and hear us now, Stacy? Give us a thumbs up.
Mm-hmm. Can you hear us? Can you see us? So this particular vial that I have here, actually, Chastity, I can get it. I'm gonna grab my little dish so I can let out some.
How you doing?
Doing good.
You feeling okay?
It's nice to be on the side of the table.
So we're gonna go in here and get out my product. So we've got our product out, and then I'm actually, can you see that? It's nice and blue, named correctly, huh? The Blue Radiance.
Ooh, smells
Put
nice.
some of this right over here. So I'm gonna go in and start. You can get right in on Amber so you can see the effects that it has on her skin. So I'm gonna start on the forehead. I'm gonna actually just place a little here, little here, little here, whoop, little here. And I want to actually do this peel in layers. So this is gonna be kind of her first layer. Now that I've got it nice and dispersed all over, we're gonna go in here, and you can see I'm actually using, the gauze that I'm using has a little bit of texture. Look how she gets nice and pink. Can you see that? Mm-hmm. Kind of gets a nice little pink to the skin. What are you experiencing, Amber? What are you feeling?
Just mild tingling.
Mild tingling. You can see we almost start to get this powder-esque look on the skin. See how it's starting? I can see exactly where we've been. That looks nice. And move that around. So on a scale 1 to 10, Amber, 10 being I'm killing you, 1 being you feel nothing. Where are you at?
20.
20!
And smile.
Honestly, 2.
A 2.
Maybe.
So I'm going to kind of look back, kind of see what's happening. We see we've got a nice, even distribution of product everywhere across the skin. Of course, we can see a little bit of pinkening, a little bit of redness to the skin. It's looking really good. You almost can see in areas that she has issues, a little bit of congestion on the chin. See how it almost wants to attack that first.
Yes.
So it's bringing out this little bit of almost like a frost look to the skin. Mm-hmm. We can really see that she's going to have good results.
Got a question. Do you put numbing cream on before the peel?
No,
or is it
she
pretty
doesn't
mild?
need numbing cream for this one. So I just asked her on a scale of 1 to 10, 1 being she felt nothing, 10 being I'm killing her, what she was feeling. What are you feeling right now on that same scale, Amber?
2.
A 2. This one's very, very comfortable. So this particular peel is a combination of alpha hydroxy acids. Very mild in the application of this peel, so it doesn't have a big bite to it, but it's extremely effective in going in and loosening dead skin cells, bringing newer skin cells to the surface. She's not going to have an excessive amount of heavy peeling to take place post-peel on this one. This one would fall into my more superficial depth peel. But layering it and combining it with good skincare, combining it with your Nuderm system is going to allow me to turn this superficial peel into an even deeper peel, more in the medium depth range, depending on how well we prep your skin. So this one is so versatile. Your Blue Radiance Peel is extremely versatile because first and foremost, if you come in today, come in for a consultation, come in today, we can perform this peel right then, no prep necessary. That's going to put it in my superficial category. And it is going to prep the skin for future peels. If you already are using the Nuderm system or you want to figure out a way to get the biggest bang for your buck for this particular peel, come in, let's get you started on the system, get your skin prepped, so that way when we do start the peels, you're going to get the biggest effect from it. I have actually been able to get patients to actually physically peel with the Blue Radiance Peel, which is amazing. And like I said, this one is safe for all skin types. I'm going back in with this second layer. And you can see I've got kind of a rough gauze. I don't think I showed you guys. Let me show you. I'll bring it over. This is the texture of my gauze. Can you see how it's almost got a rough texture to it? So with that texture that we're getting, of course, we're getting a little extra exfoliation. So if I don't use a rough gauze, and I don't have to, it just depends on where you are in your skincare needs, I can use a soft gauze, make it a little less aggressive. But Amber said, hit me with your best shot. She wants aggression, right? Mm-hmm. You guys see how, same thing, nice pinkening of the skin. She's getting a beautiful, beautiful response. I want to see this pinkening of the skin taking place. I want to see that this product is being absorbed into her pores.
Another question, is it okay for rosacea skin?
So with rosacea can be somewhat of a beast. I'm sure you know because you have it, obviously. This one can be safe for rosacea if we have your skin prepped correctly. So you want to come in and have a consultation. I would treat you more with a less aggressive peel. We can do more of a superficial peel. Here at the Laser Institute of Pinehurst, we have, goodness, Amber, help me. We probably have about 9 to 10 peels in our cosmetics. We have we have a whole slew of peels from very, very superficial all the way up to more aggressive peeling. So we do have treatment that is super, super safe and good to help maintain your rosacea. So good question. Thanks for asking. Any other questions out there, you guys? She's gonna have to sit with this for about 5 to 7 minutes. She's already sat down here for a few. Just gonna make sure I don't have any more in there. Get the rest that I've got. Make sure we get one more good pass. So how are you feeling, Amber? You tell me.
Right now, just a little warm.
A little bit of warmth?
Just a little bit of warmth.
A little bit of warmth.
Mm-hmm.
So if you are just joining us, we are doing the Blue Radiance Peel on Amber. She's doing amazing. The Blue Radiance Peel is going to be a combination of my alpha hydroxy acids, and what my chemical peel is going to do. What I like the most about a chemical peel is I can apply this particular peel to her skin, kind of assess it as it's on, and it's going to absorb into her skin cells. It's going to go in there and loosen up any dead skin cells that she may have. So it is going to help out with tone, with texture. It's going to smooth the skin to kind of give you that nice porcelain look. As well as, depending on which level of chemical peel I use, this one's a nice superficial peel. It's not too, that's why she's so calm and cool. It's not too aggressive. If you have more sun damage, if you have scarring, maybe you have enlarged pores, maybe you have breakouts. What's some other
Dark spots?
Yeah,
Melasma.
melasma's a good one. If you have a specific skincare need, we can customize a chemical peel that's going to be fit just for your needs. So whatever it is that you have, maybe you're not a chemical peel candidate, maybe you're a laser candidate, maybe you're just good old prescription strength skincare candidate. We can customize a routine specific for your needs. We're doing a Blue Radiance Peel on Amber because truthfully, Blue Radiance Peel is perfect for all skin types. So I very safely, very confidently know that I can use this peel on almost all of the patients, even hypersensitive patients with rosacea. I can use this peel very confidently, very safely, knowing that you're going to get a good response to your skin, which is another reason why it's on special this month if you purchase our Nuderm system or our CRX clarifying system. So any of the Obagi systems, our prescription strength systems, you're actually going to get this pill for free. So I'm going to let her sit for just a few minutes while she sits, since she always has to work so hard. We'll give her a little massage.
Oh, yes.
We got to sandwich in some relaxation therapy. So what other questions do you guys have? Do you have any other questions for me that you're interested in? There's so many different levels of chemical peels, and a lot of patients will come to me and they are somewhat afraid of a chemical peel, and rightfully so. You should be afraid of a chemical peel, because if you have a chemical peel done that's not suitable for your skin type, you can have some pretty bad issues to occur. So you definitely want to do your research. Here at the Laser Institute, we have a whole toy box full of chemical peels. So from our superficial to some of our heavier, more aggressive peels. What's the most aggressive peel we've done on you, Amber? Is it the VI peel?
VI peel.
VI peel. What was your experience with that one?
VI peel, my experience, it was definitely more intense during the application. Following the peel, just honestly, some, just discomfort. Once the peeling phase started with that one, there wasn't much I could do as far as applying anything topically that I felt extremely comfortable with, but it was still tolerable, knowing that I was going to have amazing results afterward. With this peel, knowing that potential, just what we call our snowflake peeling in 3 days is, something that's desirable for patients who don't have a lot of downtime to schedule, or they just don't want to. Their lifestyle doesn't necessarily call for downtime. So
right.
This is definitely something that has been great for patients in that aspect.
Yeah, so this is going to be what we're doing right now. This is the Blue Radiance Peel. This is this little fella right here. And the Blue Radiance Peel is safe for all skin types. This particular peel is going to go in and loosen dead skin, bringing newer skin to the surface. We need to do a little bit of when you use a chemical peel, you're going to use some type of acid, some type of alpha hydroxy acid that's going to go in and perform a specific job. This particular one is going to go in and soften up dead skin to help bring newer skin to the surface. So you can imagine, so as a child, we don't have to put moisturizer, we don't have to do anything really to those beautiful little babies, because their skin is just so poreless and flawless. Their skin cells are turning over so quickly, like as quick as like every 2 weeks. Then as you age, your skin cells kind of stop turning over. We get a little bit older and we're getting into that normal cycle of about every 28 days, which is exactly where it needs to be. And then we have another birthday and it slows down even more. So as you age and your skin cells are not turning over, of course, now you're reaching for this, you're reaching for the moisturizer, you're reaching for the eye cream, you're reaching for anything that you can put on your skin to help get it back to that infancy state, because it felt so good, it was so resilient, it did whatever you needed it to do. So chemical peels are going to go in and shorten that skin cell turnover time. So instead of it being past that 28 day, it can be as much as to where it stops turning over and you'll feel these like rough, dry patches, almost like barnacle type patches on the skin. That's what we want to try to reduce. That's what we want to try to get rid of. This particular peel is going to do that. It's going to help almost immediately. Right here on the table is going to shorten her skin cell turnover time. So you can see she's got this nice, beautiful pink glow to the skin. Some of the areas where she has some congestion are a little pinker than others. The little area kind of right through here. She had a little boo-boo over here. It's helping attack that.
All right. Do you have to stay out of the sun for a period of time after a peel?
So with this truthfully, we want you out of the sun unless you have sunscreen on all the time. So say goodbye to the sun unless you have sunscreen. We don't want you to be vitamin D depleted. So we do want you to have some fun in the sun. Everybody wants fun in the sun, but you definitely want to have sunscreen on. This particular peel, because we are going in and inducing some skin cell turnover, we want to make sure that we do take extra precaution post peel, and we're more cautious in the sun than we would be maybe the day before or the day of the peel itself. So yes, you do want to be a little bit more cautious. Your skin's going to feel it. You'll notice sometimes when your skin is a little reactive, that you'll go outside and it almost feels like you can feel the sun absorbing into the skin faster. So you definitely want to protect it. You want to keep that sun protection on you more so than you would, several days before peel. So this one's about ready to come off. She's done. So I'm going to go in here and basically wash the peel off. I'm going to use my Obagi Gentle Cleanser to wash the peel off. We want to it is self-neutralizing, so I don't, occasionally when I do use the cleanser, my patients will say it kind of feels like it's almost reactivating it. So if you do feel that little bit of a tingle or stingle, as they say, that's completely normal. But I'm just going to go back in with my Gentle Cleanser and kind of, this part feels really good actually, I think. And you should notice that she gets a little red again already. See how she pinkens up really nicely. Amber was prepped for this peel, so this peel is going to be a little more aggressive on her because her skin is nice and prepped. And by aggressive, I should say more effective. She's been prepping with retinol, so her skin should be nice and ready to shed. So she may actually get that nice snowflake peeling that she mentioned. Throw me up a heart if you guys have had a chemical peel or you're the least bit interested in a chemical peel. Chemical peels they're amazing, amazing treatments that you can add into your routine to really help the advancement of being proactive about sun damage. It's great. How are you feeling down there?
Feeling good.
Got 3 hearts. All right.
Also, I talk to a lot of my younger patients about being a little bit preventative and just overall aging. I feel that we have seen an increase in patients that are in their maybe late 20s, early 30s, mid 30s who are interested in Botox, interested in fillers. And then we begin to talk about skincare, and it's not necessarily that they have any concerns. Maybe they're not acne prone, maybe they don't have any sun damage, but just overall tone and texture, and being proactive in aging.
Absolutely. One of the biggest mistakes that we can make is starting too late. It's if you can stay on top of aging. So I know that sounds crazy because people are like, I don't need eye cream yet, so why are you waiting? I want to never need it. So if you feel like, now that doesn't mean you have to use the same eye cream that your granny uses and you have to use it as often, but we want to get moisture around that eye. We want to make sure that this does not lose all of its moisture, so that we're having to go in and try to play catch up. So if you are not using good skincare now, you don't want to wait until the skin necessarily needs it. We want it to never need it. I'll have patients say, I'm just not sure this is working, and then they'll stop using it. They'll stop, maybe they'll say, I'm not sure this eye cream's really working. Nah. They'll stop using it and they'll realize very quickly, wow, it really was working. So please don't hesitate to jump on the bandwagon of good skincare. Maybe you should come in and have a nice little chemical peel and see what all the fuss is about. So how are you feeling? I just took off the majority of the peel, and that does kind of almost stimulates it a little bit. The water stimulates it a little bit.
The water definitely makes you feel the tingle just a little bit more. But not bad, still not bad at all.
So it's that simple, really. Now I'll go in and put some sunscreen on her since she It's late enough in the day, but we want to still, the sun's still out. We'll go ahead and put some sunscreen on her and kind of finish off her treatment with some sunscreen. Let me just grab, I think I'm going to do this one. How are you feeling, Amber? Good?
Still good?
Good deal. Do I have any more questions? Does anybody have any thoughts on, have you had any chemical peels or any experience with chemical peels? This one really is a nice one to start. But like I said, we have a variety of them here. And if you don't know where to start, maybe you think, I don't even know what to do. Maybe I don't even want a chemical peel. We do medical custom facials, so you can come in and have a skincare consultation, get a nice facial, feel some of the skincare products, see what it's all about.
Complimentary consultations.
Yes, yes, yes. So just to remind you guys, our Blue Radiance Peel is on special this month. Amber, what do they have to do to get a Blue Radiance Peel?
Just come in and get started on your medical grade products, your Nuderm system, C-Clarifying system. You're not only going to get a Blue Radiance Peel, but you're also going to get this really neat t-shirt,
I
a
forgot about
travel
the t-shirt.
size cleanser and toner as well, and a cute little tote to tote everything around in.
Yes. So call us, 910-295-1130. We will post that in the description below so you can get scheduled with your chemical peel. And we'll have to post an update of Amber in a few days so you guys can see her. So thank you for joining us, and tell us what you want to see next. Thank you so much. Bye.
Bye.